All right, let's just get right into it. We're going to talk about something every single dog owner deals with, but maybe doesn't give a ton of thought to, and that's dog poop. But what if I told you that inside that little bag is one of the most honest, direct health reports you could ever get from your best friend? Well, today, we're becoming health detectives.
No, really, just think about that for a second. What if you didn't have to play guessing games? No more wondering, is he feeling a little off today? What if they could just drop a little note for you every morning that says, hey, all systems go, or something's not quite right in here?
Well, here's the secret. They are giving you that report every single day. You just have to learn how to read the language, and it's a language written in clues of color and consistency. So go ahead and grab your detective hat, because we are about to crack this case wide open. You know, every good detective needs a toolkit, right? Well, for this investigation, ours is pretty simple. It really boils down to two main tools: understanding consistency and decoding color. Get these two down, and you'll know about 90% of what you need to know.
Okay, first up, consistency. What you're looking at here is the fecal scoring chart, and it's a fantastic guide that even veterinarians use. So over on the far left, you've got scores from 1 to 3. We're talking liquid diarrhea. Then, as you move toward the middle, things start to get a little more formed. But the sweet spot, the absolute ideal, is right here at 7 to 9. See how it's formed, firm, but not hard? Now, if you go all the way to the right, scores 10 to 13, you're in constipation territory. That's way too dry and hard.
So what does that perfect score actually feel like when you're, picking it up? Well, the best analogy I've ever heard comes from the experts at Purina. Healthy poop should feel like Play-Doh. Think about it. It's compact, it holds its shape, it's a little moist, and you can pick it up in one clean go. If it's a mushy mess or a bunch of hard little rocks, that is your very first clue that something's up.
All right, let's grab our second tool, the color code. The normal, healthy color we're all looking for is a nice standard chocolate brown. Simple enough. Now, if you see green, it might just mean your dog's been snacking on the lawn again, but it could also hint at a gallbladder issue. Orange or yellow, that could be pointing towards a liver problem. Red streaks are fresh blood, maybe just a little cut, but it's something to watch. The ones that are a real cause for concern, though, are black and tarry. That means bleeding somewhere up in the GI tract, or gray and greasy, which can signal pancreatic issues. Both of those mean you should call your vet right away. And if you see little white specks, well, that could very well mean you're looking at worms.
Okay, so you found the evidence, the poop is off. Now the real detective work begins. We've got to figure out who or what the culprit is. And luckily, there's a lineup of usual suspects that we can check out first.
And here they are, the most common offenders. A sudden change in their diet? That's a classic trigger. Stress is another huge one. I mean, moving to a new house, getting a new puppy sibling, that's stressful. Then you have what I like to call dietary indiscretion. Basically, eating garbage, sneaking people food, or swallowing part of a toy. Of course, things like parasites or infections are always on the list too. But more often than not, the answer to why is right here.
But sometimes the culprit isn't just a simple case of a sensitive stomach. There are much more dangerous threats out there. And for these, you have to be ready to act immediately. So let's talk about the big one.
Canine parvovirus. Just the name parvo can strike fear into the heart of any dog owner or vet, and there's a very good reason for that. It's an incredibly aggressive and highly contagious virus that just wages war on a dog's body, attacking the lining of the intestines and the bone marrow. It basically shreds their immune system and causes massive, massive fluid loss. And this is why it's so terrifying. 91%, that is the potential mortality rate for parvo if it's left untreated. I mean, just let that sink in for a moment. Without fast and aggressive veterinary care, this disease is almost always a death sentence. So you absolutely have to know the signs. It almost always starts with lethargy. Your dog just isn't acting like themselves. Then comes severe, often bloody diarrhea that has a really distinct, foul smell, along with vomiting, fever, and a total loss of appetite. If you see these signs, especially in a puppy, this is not a wait-and-see situation. This is a true emergency. You call your vet immediately. Now look, whether it's from something as serious as parvo or just a simple stomach bug, all that diarrhea and vomiting leads to another major threat that can become a life-or-death problem all on its own, and that is dehydration. It sounds pretty simple, right? Your dog is losing more fluids than they're taking in, but what that actually does is cause their blood volume to drop, which weakens circulation. That means their vital organs, especially their kidneys, aren't getting the blood and oxygen they need to function. A dog can go downhill incredibly fast from dehydration alone.
So the good news is there's a super simple 60-second test you can do at home. Every dog owner should know this. Step 1 is the gum check. Just gently lift their lip and touch their gums. They should be slick and wet. If they feel sticky or tacky, that's a warning sign. Step 2 is the skin tent test. Gently pull up the skin between their shoulder blades. In a well-hydrated dog, it'll snap right back into place. If it goes back down slowly, or even stays up in a little tent, they are almost certainly dehydrated.
Okay, detective. You've gathered all the clues, you've assessed the scene, you've checked for immediate threats. Now, it's time for the most important part, your action plan. What do you do next?
This breaks it down perfectly. Here's when you can probably just monitor things at home. If it was just a one-time thing and your dog is otherwise totally normal. They're still eating, drinking, playing, they're fine. But here's when you need to pick up the phone and call your vet. If the diarrhea goes on for more than 24 hours, if you see any of those scary colors we talked about, like blood or black stools, or if it's happening along with other symptoms like vomiting or lethargy. And a special note, for really young puppies or senior dogs, it's always better to be safe than sorry and just call.
And honestly, that might be the single most important takeaway from all of this. At the end of the day, you know your dog better than anyone on this planet. This guide, it's your detective's toolkit, for sure. But your intuition, that's your most powerful tool of all. If something just feels off to you, don't second-guess yourself. Trust your gut and call your vet. It is always the best way to keep your partner in crime safe, healthy, and ready for your next adventure together.